Hi everyone, in this video I have referenced a small clip of a video of a pet who died after the pet was sick and was given some prescribed medication. Despite that, that pet ended up dying a few days afterwards, and that was the last video clip that the owner had, and that's why they had posted it online. But when she posted it online, I think some people had commented regarding the video, based on which on the pinned comments there's a whole section that explains why she gave the pet the medication inside a banana, because the pet enjoyed eating that fruit. She hid the medicine inside food and gave it to the pet. Now, and I'm assuming it's a she, it could be a he. I didn't check any other videos of this profile, so pardon me if I'm wrong about the gender of the owner. But what I want to focus on, as a former pharmacist, I have worked as a pharmacist in US. So the way a pharmacist works in US is clinically and technically very different from in many aspects from how a pharmacist works in India. That's why the job role that I had also involves counseling patients on medication side effects, on drug interactions, and also, apart from just being a pharmacist, I had a master's degree in pharmacology, where I have done research work on health harms or toxicological impact of certain medications on human health, or if not medications, even chemical impact on human health. So this was part of my work life experience and study experience from US. So even if I'm not currently a practicing pharmacist, I do not have any active licenses also, because I currently don't live in US. It doesn't mean that the knowledge I had while practicing as a pharmacist, or even my master's degree, completely discredits me from understanding certain impact of chemicals and medications on human health, right? Because that theoretical knowledge that I have, even if I'm practically not licensed or practicing healthcare, doesn't take away the knowledge that I've already gathered. And apart from that knowledge, in recent years, I myself have faced health issues from medications and chemicals in our food, water, air, and even clothes. Because I went to near cancer levels. Actually, technically, I am in some cancer stages right now, and I also have some organ damages that were going on with my health from the chemical contaminations that I have been exposed to, because of which I understand this even more deeply right now, as a person suffering from the chemical pollution that is present on earth, from chemicals that are used in our daily life, chemicals that have been normalized as normal to use in our daily life, and drugs, medications are also in fact chemicals. So they also have an impact of harm and benefit both on our health. So now, the reason why I have referenced this video, actually I have watched multiple other videos of different kinds of pets in the last few years. Pets who were refusing to take their medication, just like how she mentions her dog was refusing to take the medication. But despite that, and it's not simply pet videos, I know as a child also, sometimes young children also refuse to eat food, don't want to eat certain medicine, don't want to consume something that the parent is thinking this is healthy, that's why they are pushing it, that their child should drink it, or like, things like Complan, Bone Vita, or some healthy food like some vegetables and fruits that we normally know are nutritious and are supposed to be healthy for human consumption. So many a times, and I've watched kid videos, pet videos of dogs, birds, other animals, where animals are suffering, kids are suffering. Unfortunately, their parents or caretakers are highly unaware as to why these kids and animals and pets are suffering. And in my own family life, I also have some elderly people, disabled and diseased people who are have gone through years of suffering, even though they were given medicines for their health conditions. Sometimes their medicines were prolonging agony that if they had actually died, it would have been more merciful for them, because their life conditions are such, or the medications that they are given are legally prescribed by doctors are such that they are causing health harm. And as a pharmacist and a pharmacology student, I know technically which of their medications are actually causing and worsening the health status of a particular patient. But despite my knowing it or having the knowledge for it, the strong false belief system that many people hold about medications and other problems related to our daily life, and the denial that people have that sometimes they can be responsible for worsening someone's health, all these combined have led to a condition where I have a very hard time convincing people in my daily life or about some of these impact of chemicals on our health. And even though I have a hard time convincing people, it doesn't deny or take away from the truth if someone in my daily life doesn't acknowledge that I have a particular degree or a particular work experience that makes me talk about this issue. That's the reason why I have also started creating online videos, because in my personal life I don't know how many people are actually listening or ready to understand the roles they are playing in their own life when their health or their loved one's health or their pet's health or someone they are caretaking, their health is getting worse as a result of some choices they are making, some unaware and unconscious or ignorance driven choices, and some normalized practices and choices that are harming someone related to them who is just simply much more weaker in health than that person. So that's why sometimes many of us make these unconscious unaware choices, because if we are not suffering, many people do not realize that what is causing a suffering to someone else is less easier for them to understand that suffering of someone else. Because even though I am a pharmacist, I am a pharmacology student, like me there I have teachers who are pharmacologists, people who have even doctoral degrees in pharmacy, much more higher degrees than me in pharmacy, people who have much more longer work experience timeline also in the pharmacy field than I have, like from my own colleagues, because I have shifted my career in many ways in many fields. So while I have only about 12-13 years of healthcare practice knowledge in US, I have friends who have 20 plus years of healthcare practice knowledge, people who are doctors also who have more than 20 years of knowledge. But despite that, many people are unawakened to the health harm of medicine, health harm of other chemicals plus medicine, health harm of medicine, food, water and everything combined that could lead to someone's death. So in the simplest scenario, I don't know what happened to this dog, because her videos I haven't watched. If I even watch the video, sometimes I can intuitively gauge from a pet's video what is some of the lifestyle related conditions that could be impacting their health. And sometimes even if I don't watch someone's video, with humans, just the way a human responds or a pet responds, their intuitive response to a medication or something in their home environment also is capable of showing humans or their caretakers what is it actually that is making this resistance happen in a child or a pet. And with pets, pet may not be able to speak up and tell you what is going wrong, but children, if they are younger, they might have a hard time explaining why they are refusing something. But if parents actually ask them deeper questions, they will themselves understand what the child is resistant, when the child is resisting sometimes some food, and if the child has some conscious awareness of what they are resisting. Because if the child is like a 2-year-old child, 4-year-old child, at that time they might not know why they are resisting something. They might just end up saying that this thing tastes bad or smells off or something like that. or they will just say no if they don't even have those communication skills at that age. But if the child is 10 20 10 15 years old, at that time if you actually realistically ask your child why they're refusing to eat something that is apparently considered as healthy, by that time if they have developed the consciousness, they have also developed some educational knowledge from their biology or other information that they have gathered as a normal life experience. Some of those children, older children, can also actually verbally tell you why they might be refusing to eat something. Now let's come back to this particular dog. The dog's health, if you look at the dog's video, the dog looks a little older in health, but other than that, the dog actually looked pretty fit to me. So whatever was the reason for the dog's health deterioration, now the problem in India is when someone falls sick in general practice, if it is a dog, if it is a human, if it is a child, most general practitioners will first normally assume that if someone is vomiting, maybe that person or child or dog that is vomiting because of some food poisoning or something. So they will give either very preventative care like strategies are sometimes used. They just want to stop the vomiting from happening, because if you vomit too much, what will happen, you will emit out all the nutritious food and drinks that you have consumed, and when all the nutritious food and drinks that you are consuming or a pet is consuming is all vomited out or pooped out, and if you have assumed that it is food poisoning from some bacterial poison or something, what are the likely medications some doctor will prescribe? First, they will give anti-vomit medicine to stop too much of vomiting. Second, other than the anti-vomit medicine that would be given to an animal like a dog or a human, what else will they give? If they think it's a bacterial or viral infection that caused it, sometimes some antibacterial drugs they will give. For most of the time, except for some stomach flu, there are not many medications for viral stomach flu that doctors usually prescribe, because anyways for stomach flu the medicines that were prescribed will only help a little bit, they don't really help you much. So if only it's a bacterial infection, most times some antibiotic will be prescribed. If they think there might be a parasitic infection possible based on the symptoms that were narrated, then some anti-parasitic drug also might be given to the person who is falling sick and what the doctor has perceived is happening to the patient. But irrespective of whether that patient was a dog or a human, and if this is the trend that the practitioner would normally prescribe, and being a pharmacist I know this, what is the common prescription that would be given. In my pharmacy we also had some pet medicines that we used to sell briefly for a few years. So I don't know very much detail about veterinary medicine, but general standard medicine is practiced this way. If a pet has that issue now, why am I bringing a food poisoning related issue here, is because the chemical pollution that is there on earth currently impacts mostly our food and drinks and our water supply that we use for bathing, and because of which, and also impacts our air. So some poisoning can also happen from contaminated air pollution in your neighborhood. So if you say you live in an industrial zone, if you live very close by to some industrial zone and they emit a lot of gases which are not regulated properly by your local regulatory bodies, what is going to happen, that industrial closeness to your industrial environment will cause your air also to be polluted, and the local waters and soil might be polluted, because of which your food, water, air, everything gets contaminated. The clothes that you're washing in that water will get contaminated. The bathing that you're doing will also have some contaminations. The water you're drinking or using to cook your meals will also have contaminations, and all of these contaminations combined and the multiple exposures that is happening when you're bathing, you're absorbing if there is some pollutant in your water while bathing, the pollutant is now getting absorbed via your skin into your body. When you are cooking food and that food has water that is contaminated, now your food content has that water, or you're drinking water and your drinking water supply is contaminated, again the polluted water is getting inside your body, the polluted food is getting inside your body. If the localities water, air, soil has got contaminated, then the plants that are being raised in that locality also are slowly starting to increase their poison content inside them. Because say there was a factory that was there which is polluting your local environment. 20 years back maybe the factory started. In the first year when they did some data analysis, they saw that nothing has happened, the plants are okay, everything is okay. But in 20 years there is a accumulated pollution also that happens on a particular area, and that accumulated pollution now slowly if in the first year the soil had only 0.1 of some particulate matter of pollutant, now in 10-20 years slowly over time that buildup has happened, because of which now instead of the 0.1 it is 10 times, 20 times, 100 times more, depending on how profitable that factory is, how much effluents have increased, are there other factories that have come up in that area, are there other pollution enhancing factors also apart from a factory. Like when a factory is there, job is there. When a job is there, more people also will be there. When more people are there, more chemicals are going to be used even in our daily normal lives. So all of this combined then adds to, in the 20 years whatever development happened in that area, all of it adds to the local pollution. And then while development is leading to certain pollution parameters to exist in a particular area, if people don't do the right health studies, safety studies, understand properly how development is impacting some areas, health based criteria, or if the people who understand partly or superficially what is impacting people's health but don't understand the deeper reasons why someone's health is getting impacted, this is how things will manifest. That someday a pet, or someday a child, or someday a really sick person will, who has consumed that area's water, air, food for 10 years, 5 years, 7 years. This pet was 7-year-old, so and I don't know if all 7 years they lived in that same locality, but if they've lived in 2-3 different localities, that pet's health has been impacted by 2-3 different localities environmental conditions. If the pet has lived in 2-3 different housing, then 2-3 different housings environmental conditions can impact. If the pet because their housing conditions can impact their water supply from an air supply, and from which that can manifest. Or even if if you have lived in 2-3 different cities, then into the city specific air pollution, water pollution, food related, pollution related parameters, all this will be impacting this pet's health. But apart from that, what else is impacting is the medicine itself. Even the fruit itself could also be impacting their health, because our fruits and vegetables are also not immune. Apart from just pollution adding to a fruit and vegetable growing abnormally or having poisonous content in them, if a farmer or a gardener is growing some fruit and vegetable, they're growing a banana tree and they want to rapidly grow many bananas, so they are spraying on it fruit ripening agents. Or if not, the farmer is doing that, the one who is the seller, he might be buying the banana raw but he wants it to ripen quickly, so he's spraying something, whatever it is, whether it's the seller, whether it's the gardener, whoever has added and sprayed chemicals on it, or they are afraid of pests going around in the storage area where the banana plantation people are storing their bananas, then at that time in those pest control related activities, all of these add to more chemical pollution even in the banana. Same way, the facility where now drugs are getting manufactured, if the drugs are getting manufactured in a particular facility and say they are following all the manufacturing principles that are set by the normal governing bodies, that this is how medicine has to be manufactured. But for example, someday because of pollution parameters increasing on earth, there or some other condition that manifested in a particular facility facility where a drug was getting manufactured, or when sale of drug was happening, if something manifested, drugs also have a chance of getting contaminated. A simple thing like a tablet which is there in a foil pack can also have the potential to be contaminated, either in the manufacturing step or in the sales steps, or even in the home storage step. Like say I wanted to give medicine to the dog, and she said that the dog was refusing to eat the medicine. So this is possibly like a daily thing that she might have been struggling with the dog, that sometimes the dog might be refusing to take medicines. So when the dog is refusing, she might have left the medicine out in the open, out of the foil, and she might have gone to do some chore for a few minutes. And in the meantime, while she's doing some chore, if in that environment there was some industrial zone that she's living in, and there's some air pollution, that air pollution related chemical could have got absorbed by the medicine. Or if even if the medicine was completely manufactured in the right way also, when someone is really sick, even microscopic amount of something that is toxic specific to that weakened person's body can also lead to worsening of their health, which has happened to me. Like when I was in worse health conditions, I didn't know that my liver was getting damaged at the time, or some symptoms of liver damage was showing up, but they were not very blatant liver damage. So because the blatant liver damage related symptoms hadn't shown up, it was very superficial damage that was showing up. When I was given a medicine which has a potential to cause liver damage, as soon as I took the medicine, it was causing me pain in the area where my liver might be. And that's when I realized that, okay, this medicine is worsening my health. I may have liver damage. I did some other studies also which showed a little bit more clearly that liver damage was going on in my body. But even if I do this test or not do the test, because I am a pharmacy student and I also have some clinical knowledge, I understand how to read my lab reports, or even because I live in India, it was easy for me to go at a diagnostic center to get a test done for myself without a doctor's prescription. Some tests can be done like that, not all tests, but some tests can be ordered by someone for their own personal interest. So I ordered the test to figure out that I had liver damage going on, and because I had the knowledge that this X medicine that was prescribed to me was worsening my liver health and was causing me some physical health symptoms also, and I know that also, theoretically I knew that this drug has a potential to cause liver damage, I stopped taking that medicine, which is a normal prescribed protocol. You have to always assess the risk versus benefit of taking a medicine. This is the protocol followed in US. This is actually technically the protocol that should also be followed in India. But India or any other country where medicines are sold and prescribed and used by patients, be it an animal, be it a human being. But even though that is technically a protocol everyone should follow, that risk versus benefit should be analyzed when given a medicine. Very rarely in India this is followed. It's mostly followed when someone is possibly hospitalized, then a hospital doctor follows these protocol to analyze whether certain medicines that their patient might have been taking for a long time should be given, not given. These kind of things a doctor might do. But general physician doctors in India, I have rarely seen a general physician doctor actually address this issue, that if a patient has a problem with their medicine. In my family life, I have had a very high degree of resistance from family who are practicing physicians for many decades, but they refuse to understand that if a medicine is causing health harm, you should not be taking that medicine. For them, unless a doctor suggests that you should not take a medicine, everyone else is wrong if they stop taking medicine. But which is actually the false belief system that people hold. If I know my body is getting worse because of taking a particular medicine, I shouldn't have to wait for a doctor to tell me don't take it. It's like, say, you know how to ride a bicycle. Because you know how to ride a bicycle, someone who is a moderate to expert driver also knows that how to avoid potholes, also knows if they are driving in a particular neighborhood for a long time, where if a municipality hasn't fixed the potholes, where the potholes are. If I go down this same road every day, I know in this X stretch of road where the potholes are, or the bumps are, or the speed breakers are, and I will attune myself according to the road. Now, do I need a cop to tell me do not drive near the pothole or do not drive near the bumps? No, because I'm already driving down this road for a long time. I know this stretch of road, so I know what is health safe for me, what is not health safe. When will I need someone else to tell me what not to do that might be harmful for me while I'm riding a cycle in a particular stretch of road? When suddenly there is a new pothole, or suddenly some road construction is going on. At the time, if I wasn't aware, like yesterday when I drove, there was no pothole there or no construction going on. So I am not aware since the last 10 hours or something that something has changed on this road. At that time, if some individual comes and tells me, hey, there's construction going on, so be careful, or a friend tells me like, hey, I know you go down this road every day, there's construction, I don't know if you know about it, that would be helpful for me, right? So a doctor is like that. If doctor is supposed to tell you what is the health harm, you may not be aware about. But if as a patient you already know of the health harm potholes of your life, you are meant to take care of your own health, and you have the agency to take care of your own health. That is a legal right of every human being to refuse taking a medicine if they know that that medicine is harming them. And while I am as a pharmacist more theoretically knowledgeable about this, practically knowledgeable as a licensed pharmacist, I gave these kind of recommendations to patients also, that hey, if you have XYZ side effects from your medicine, you should talk to your doctor to get the doctor to change your medicine. This is the advice you have to give the patients in US. But in India, none of the pharmacists give these kind of advices. Patients don't even get usually drug specific information. You can go and Google up a drug specific information online from many websites that do give you information about drug related harm. There are many medical websites, there are many apps also that provide that information. Multiple resources are available for you to know this information of when a medication is causing harm. So I would recommend this girl, even though she feels she was not responsible for the dog's death because she was giving the dog a prescribed medication. If she wants to become a future pet owner or a better pet owner in the future, she should definitely look at all the medicines she gave to this dog and check out if any of the side effects of those medications had shown up in her dog's health status before he died, because that information is relevant for her. Because if say 10 years down the line she is again having another pet who is now 5, 6, 7 years old or 10 years old, and that pet is having a health harm related to a medicine, now she doesn't need to go and wait for the doctor to tell her that the medicine is causing health problems, or she doesn't need my guidance from this video to tell her that XYZ medicine could potentially harm her dog. That information should be available and accessible to her now that one pet has already died, if that pet died from some side effect related to medication use. This is one aspect this girl needs to learn. Everyone else who have a pet needs to understand this about the medicines they give to their pet. Second thing that pet owners and children's parents or elderly caretakers or anyone who is really sick, their caretakers need to understand, every time you give 10 set of prescribed medicine, 5 set of prescribed medicines to any patient, each of those patients' medicines, you should do some due diligence about the side effects related to those medication use. In case ever those side effects show up, you realize it's the medicine that might be the root cause. If not you realizing it, you should ask the doctor those questions, deeper questions, so that the doctor realizes that sometimes the side effect of a medication could be at play. That is another thing people have to understand. Another thing that people have to understand, the third key thing from these videos that I have observed, and if I find other videos of other pets or children refusing to eat something, I will post here. I had posted another video a few days back about children refusing to eat something, and like that. I have multiple videos I have seen where people are refusing something. They are either refusing to consume something, refusing to sleep on a particular bed. When it's a small pet like a squirrel, I've seen a squirrel video where the squirrel is refusing to go and sleep in particular corner of a room or a place where it has been created for it to sleep at, but it doesn't want to sleep there. I've seen pet videos where pet owners, many people who own dogs, they sometimes criticize smaller dogs for being very cranky. That crankiness also of the smaller dogs comes from similar issues like this. I'll make a different video about the smaller pet related crankiness. But what people need to realize, if their pets are refusing to take sometimes some medicine, there is usually a intuitive guidance that is coming from the pet, and not just the pet. If a child is refusing to eat some food, if a child is refusing to eat some energy drink, if a pet is refusing to take a bath, if a child is refusing to take a bath, all these, and even if an adult is having a problem taking bath daily, those are times where people might want to examine, do you have water pollution in your home? Because if water pollution is there, even if you might not have detected the pollution consciously, or you don't have a conscious awareness about some pollution going on, subconsciously, as a protective mechanism of your body, if slowly the water pollution has started causing some organ damage in some of your organ systems, slowly your body will shut down. Because this is what happened to me. I got severe appetite loss for a long time in the last few years. A couple of different time points I got this appetite loss. When I was in the cancer levels, I was in some other health problem and organ damage levels, my body was automatically shutting me down from consuming certain food. If I buy a bottled water like this, sometimes my body tells me not to drink this water. Why? Because consistency in India is really bad. So the same brand's water, if I buy from different retailers anywhere, be it an online retailer, be it my local shops, be it a local medicine shop, be it a mall, wherever I buy X brand product, it can be X brand, Y brand, and I have bought multiple brand water bottles in the last few years. And I'll tell you, there's no consistency in the manufacturing processes or in the selling steps. Some kind of problem is going on, because of which the water is not always pure water. Instead of water, there is some contamination in the water. Some contamination is direct, deliberate contamination. Some contamination is inadvertent contamination based on the manufacturing facility related issues. So whatever it is, whether it's direct contamination or indirect contamination, that is a different topic to be explored. But if there is a contamination even in a bottled water, and my body, even if I don't know what exactly XYZ chemical is present in this bottled water, when it should only have pure water in it, at that time my health will deteriorate. There are also many bottled water which have water plus minerals added to it. Again, if those minerals are harmful to my health, say I have organ damage going on, and one of the mineral in it is harmful for one of my organs, then consuming that water will also lead to my organ damage and poor health status. So at that time, what is safer? Is it safer for me to consume a water that will poison one of my organs and then lead to my death? Or should I stop consuming that water, or should I reduce consuming that water? Stopping or reducing consumption would be a safer choice. So like that, the animal who is now same way intuitively guided and understands that if I consume this, maybe the animal took the medicine first 2 days willingly. At that time it didn't realize some harm was happening to its body, so it took it. But if there was some real harm from the medicine, or from the water plus medicine, or from the food plus medicine, because multiple factors could be involved in this dog's health harm that was going on with the dog. So whatever factors were involved in the dog's ongoing health harm, when this dog ended up consuming this medicine that it was refusing to consume, the reason why it was refusing to consume was because its senses could detect that there's some chemical in it that is not aligning with my body. Now sometimes you can have your sense of smell telling it to you. Like for me, sometimes when I'm drinking a bottled water, while drinking it, if my sense of smell is at a good position, like let's say I don't have flu or any other symptom going on, while consuming that water I can smell something odd in it and I know this is not pure H2O, I will not consume it. But sometimes my nose can't smell it if I'm having a flu symptom going on, and if I have flu symptoms going on, or if I have cancer or other organ damage going on which have caused my senses to now get blocked for some reason, then also even if I get impure water, I may not sense it via smell or taste that something is wrong with the water. But even if my nose and mouth is not smelling tasting something off from a water or a food or a medicine I'm consuming that is harmful to me, after I have consumed it, how it interacts with my body being a very all of our body, all organic human beings, pets, any organic living being on earth has an intuitive guidance on what is harmful, what is not harmful for them. So even you don't have to have a technical knowledge like a doctor or a pharmacist or a pharmacology student or a PhD student. Nothing. You don't have to have that technical knowledge at all to know what is harmful for your body. Your body can automatically tell you what is harmful. And at those time points, some children might, cause a tantrum when the parent is forcing them to eat something that they shouldn't be consuming because there's some chemical contamination going on or microbial contamination going on. Same way with the dog. Let's say there's microbial contamination going on in the water, there is chemical contamination going on with the fruits and other food the dog is taking, and some additional chemical contamination overload is happening anytime they are getting a drug. Because you have to understand, every medicine that is pharmaceutically manufactured has at least 4 or 5 different chemicals usually present in a small tablet also. So there are at least 5-6 chemicals that compose that tablet. So it's not necessary that the X drug in the tablet itself is causing its side effect or health harm. If along with the X drug there was a coloring agent, that coloring agent could be causing a health harm leading to liver damage, leading to finally the death of the dog when all the damages in its body added up enough to cause its death. Or it could have some other chemical in it that was harmful to its heart and people didn't realize that it's harmful to its heart, and then it led to some cardiac arrest or something. So I don't know what happened to this dog. Was it a liver damage, organ damage, heart attack, respiratory distress? Sometimes people are also allergic to ingredients in a medicine as well, allergic to food, allergic to chemicals in food, so allergic to chemicals in our water supply. So all these things also, if you are allergic to something, and initially you will, when I know like I'm allergic, like I'm getting a scratch or I'm getting a cough from consuming a tablet, if I'm an adult and I understand that taking this tablet is causing me to cough or causing me to have breathing distress or causing me to have skin irritation, because I'm an educated adult on allergies, I know when an allergic reaction is happening. And because these are all different allergic reaction, most people think allergies means redness will happen or you feel like scratching. That is one type of allergy, when you feel like scratching and red rashes will show up on your face or skin. But there are other allergies where patches and scaly patches can develop on your skin. There are other allergies where after you consume something that is causing allergic response in your body, you may start coughing, you may start having breathing distress. There are also severe allergic hypersensitivity reactions to chemicals that you are consuming, which being chemicals, being something alien and different from your body, and if your body is highly allergic to those chemical components, if you consume a particular food or consume a particular medicine that you are allergic to, when you consume it, you can have such a severe reaction that you can have heart attack, respiratory arrest, and die as a result of consuming something like that. So I don't know if the dog died of consuming something that it was allergic to, whether it died of consuming something that led to long-term organ damages which slowly built up in your body. But organ damages, the problem with organ damage, like for me, I have been existing with some organ damage for the last 3-4 years. Even though I've been existing with organ damage for the last 3-4 years, some of the chemicals that I understood are causing me organ damages, those chemicals I stopped using. Like if I'm using a shampoo, it's causing me extreme skin irritation, I stopped using those shampoo products. If I used to wear gold jewelry, but even though I used to wear gold jewelry for 10, 20, 30, 40 years of 30 years of my life, I have worn gold jewelry. In the last 5 years, very rarely have I been able to wear gold jewelry because I'm getting allergic reaction to gold jewelry. When makeup related products, maximum lipstick or lip gloss nowadays I'm able to use, but there was also a phase of a severe allergy that I had a few years back when I wasn't even able to use any chemicals on my face or skin. So I had only water to use while taking a shower. Or if there are chemicals and dyes in my clothes, I'm getting severe allergic response to some of the chemicals and dyes in my clothes, which lead to allergies. I have to wash my clothes really well to wear them. If the chemicals are able to be washed away really good, then I can wear those clothes. And there are so many pieces of clothing I bought recently where I can't wear those clothes because the chemicals are so contaminated in that clothing, or there was some chemical in my washing liquid that was so highly toxic to me that those clothes are steeped with that chemical, and now I can't wear them without having some allergic or health response. And if the toxins in my clothes would be high enough, someday from the clothes only I can die, allergic reaction to some chemical in the clothes. Or if I consume food, allergic reaction to the food, I could end up dying. So same way with this dog, when the dog is refusing something, when a small child is refusing to eat something, it's not necessarily like, and I have had these problems with food also. Like for years and years I have consumed cashew nuts, for years and years I have consumed lemons, but peanuts, everything. But there was a time when some of the nuts were giving me allergies. Why? One, I was in a heightened allergy state, that's why it was giving me allergy. Second reason, in recent years, because a lot of chemicals have been used for so many decades in farming practices and storage practices and other processing industries, our nuts and whatever we are getting in our home life from a farmer, also directly or indirectly via packaged goods, they are all contaminated sometimes with certain chemicals that could be toxic to our individual specific health. And earlier, just washing your nuts, soaking your nuts and then consuming it was okay. But while washing and soaking your nuts also, if your home water supply is contaminated, that also while soaking, then the contaminated water is also getting absorbed by the nuts. So, or while washing the contaminated waters, contaminations are going into your nuts. So that's why it's very important for us to have clean water, clean food. And if clean farming practices are not done, clean food processing practices are healthy, food processing practices are not done, they all, every step where a harmful chemical has been added to whatever we are consuming, every step or every year before the plant was raised, other plants were raised using chemicals that have contaminated our soil and water. All of this slowly adds to the earth pollution, slowly adds to the food and water pollution, and then when you consume those food and water, it adds to your overall health harm. And then suppose this dog or a person like me is already health harmed for a long time, but the owner didn't understand, because a 7-year dog, even though the dog was only 7 years old, if you looked at the skin of the dog or the fur of the dog, he looked much older than a 7-year-old dog. So why was that happening? Because maybe there's some water pollution going on that could have led to its skin, wrinkling and getting older sooner. Or if the food that he is consuming, if he's daily consuming hormone laced dog food, even those hormones in his dog food will help him age faster. So even though he is technically a 7-year-old dog, unless there was a spelling mistake, but he acts like a aged dog because his body has aged faster because of a consumption of foods that have aided his aging. that also adds another element. So there's a lot of elements people need to look at when a child is refusing, a dog is refusing a food or a medicine, or trying refusing to bathe, because there are deeper reasons. Most of us assume that, oh, my dog is being naughty, or my child is being naughty, or my child doesn't know what is healthy food, that's why the child is refusing. But there are many healthy foods I have had to refuse in recent years. Like, I used to love eating mangoes and certain kind of fruits, but those same fruits that I used to love consuming earlier, even if microscopic amounts of some microbe or chemical are there in those fruits, I'm unable to consume them anymore because my health is in such a precarious state. Which is what happens, like when people are refusing certain foods, their body is in a health distress phase, or future health distress might arise, because of which a pet or a human might be refusing to eat certain foods, consume certain drinks, consume certain medicine. So please look into this, and if you have any other questions related to this topic, please drop a comment. I would be happy to help answer some questions. Thank you.